Welcome back to our channel. We're going to talk about something that I get, well, actually a lot more common than actually you realize because we're in the game. So people always ask us and actually even confuse Botox
From filler.
with filler.
It is something actually I get asked a lot in clinic. I get asked by family, I get asked by friends, and even by people who've had Botox and fillers for years.
Yeah, so, I mean, and you get the news articles saying, this celeb ruined their face with Botox. And there's no Botox in there. It's just like filler, and sometimes it's even surgery. So that's the reason why Botox in particular gets a bad name.
Okay, so let's debunk the myths and let's compare the two.
Okay, perfect. So what is Botox?
So what is Botox? Botox is a toxin. It's from a bacteria. It's from the same bacteria, Clostridium, that's the name of the bacteria, that produces tetanus.
Yeah.
But it also, a subspecies of that bacteria produces Botox, botulism toxin. And that botulism toxin is a neurotoxin. So it paralyzes the nerve, and it paralyzes the nerve to weaken that nerve, to stop it transmitting and therefore weaken the muscle.
So it's like a blockade.
Absolutely. And the reason I'm doing this is because if I were to put Botox into my muscle, here, my biceps muscle, I wouldn't be able to contract it. Tetanus, which is actually produced from the same bacteria as I mentioned, would cause a spasm of that muscle.
Yeah.
I don't know of any medical use for tetanus.
Okay, so look, one of the other questions following on from that I get all the time is Botox gonna poison me?
No. Why is it not going to poison you? Because it's dose dependent. It will not poison you. In fact, Botox, even the high doses, will not poison you. All it does is paralyze the muscle. And if it's very high in dose, which of course it would never be at levels in the clinic that we inject or is injected in any clinic, but if you were to get botulism toxin poisoning, which still happens around the world, and it used to happen in the UK, from food mainly.
Tins and stuff,
Tins, canned foods. You would get a significant amount of Botox into the system and it would actually paralyze your breathing muscles. So actually when you treat botulism poisoning, you just ventilate the individual until the Botox wears off.
Okay, so like in a summary, what the Botox molecule does is that you've got two nerve cells that sit like this.
Yeah.
And when the brain says you need to contract, it connects everything.
Yeah.
So Botox sits in that connection. And people say, how long does Botox last? Well, Botox does actually sit in that position to block that neurotransmission. It sits there for actually about a year, but the effects of Botox only last around 4 to 6 months in general. And that's because our bodies are adaptive organisms. And that means that it works around that blockade. So you get new sort of dendrite formation around that area. So, and that's a common myth. People say, my Botox wore off. Well, actually, it's not the Botox, it's you going around the blockade. So it's actually human being dependent, actually. So it's person specific, how long your Botox lasts. It's not got anything to do with the actual person that's injected it.
Indeed.
So just remember, because it wears off in the body, you'll never have a long-term problem with Botox because it wears off. So all side effects essentially wear off as well. Now you can never say never in medicine, but hey, I've never seen it in more than a decade of practice injecting tens of thousands of patients with botulinum toxin. I've never seen a long-term problem with it. So what is filler, Dr.
So what is filler? Filler is a sugar. It's actually a polysaccharide sugar gel.
It actually tastes sweet. I've tasted it before.
It does, yeah, and you can actually safely eat it. Not that we are suggesting, a disclaimer here, do not eat filler, but it is actually edible. Filler is created in the lab. Hyaluronic acid, which is what filler consists of, is a natural sugar in the body that actually keeps the skin plump, keeps the skin looking young, attracts and stimulates collagen. The filler that we are injecting is artificially produced in the lab, and there are different ranges of filler. That's a topic for another video, but in brief, you have fillers that are very watery and you have fillers that are very hard, and that would dictate what you inject and where you inject it as well.
Yeah, I mean, look, I get a question on a lot of socials. Obviously, I'm a key opinion leader for one of the biggest filler brands in the world, Restylane, and I speak worldwide for them. I'm one of their consultants, and look, they have a big range of fillers, and as do a lot of brands, but there are different properties in fillers. Some are more flexible, and more stretchy, and they are designed to be injected in areas that move a lot. So for example, the lip area and this lower face, and some are designed to lift and stay in a certain position. So like beautification points of cheeks, for instance. So it's about choosing the right filler for the right indication, and dependent on the structure of it, there's also these bonds that are there, right?
Yeah. So they're all sugars.
They're all sugars. They're like people ask, what's the difference between the hyaluronic acid I put on my skin and the hyaluronic acid in filler? Do you want to explain that?
Absolutely. The hyaluronic acid you put on your skin tends to be of more watery consistency. The filler, not only is it sterile because we are injecting it into the skin, into the body, it's cross-linked. Do you want to explain what cross-linking is?
Yeah, so basically you've got a chain. So you can have like a single molecule of hyaluronic acid and then you can join them together as a chain. Then those chains are then twisted like this, and this is what you call cross-linking. There's another compound that's in that cross-linking process. It's called BDDE, and that has sometimes been linked with some certain autoimmune conditions, but it's i.e. your body reacts to it, but it's extremely rare. Some brands such as Restylane have Nasher technology where the strands are naturally cross-linked, so they're allowed to naturally cross-link within the process, and that's got less chance of any inflammatory reactions, and so they say in certain studies, okay? But the degree of cross-linking then dictates how kind of firm the gel is and the consistency. And then there's certain different biochemical engineering that allows things to be stretchy. I mean, it's so cool. Like, you just do not realize in that small syringe, the amount of science that goes into it is incredible.
So if you laid them all out and you started with the softest hyaluronic acid to the hardest hyaluronic acid, you'd almost have like water and jello on one side.
Exactly, and some of them, as you've seen in some videos, I inject like this, and it's like a chewing gum, like an injectable chewing gum, and that's got great use in the face, and it's about choosing the right filler for the right thing. Yeah,
so Botox being a toxin, filler being a gel, how do they sit differently in the skin and in the body?
Well, Botox is pretty much immediately absorbed. You get this kind of little bit of swelling around the injection points, and after 10 to 15 minutes that goes down, and obviously it finds its way into that receptor essentially. You can get an effect, especially with certain brands, for example from Galderma, their botulinum toxin can even act even within a day. So 20% of people get a result even within a day. Probably about 80% at a week's time, you start seeing results from Botox. And at 2 weeks, probably everything is a lot more kind of essentially stable, and that's probably the aesthetic result you're gonna get. With dermal filler, it's an immediate volumizing reaction. So it's gonna sit at different layers in the skin. It can even sit on bone, in the deep fat pads, even sometimes in the muscle layer if you're quite careful about where you inject, and just underneath the skin as well. So it can sit pretty much in every layer of the face, filler can. And it sits there for a period of time in its entity, and then after a period of time, it's almost like any implant. Your body grows in and around it. And hyaluronic acid is a precursor, so it's a pre-molecule for collagen. Absolutely. So around 20% of the injectable will generate collagen. And this is why, although fillers and manufacturers say that filler lasts 9 to 12 months, there's probably going to be a large proportion of it, at 20% of it, that you will get some permanent aesthetic result from it. And that's the reason why you have to be really careful about the amount of filler that you inject over time, because you will gather it, and it's not sometimes so easy to dissolve, right?
Yeah, absolutely. So with Botox, you can't take the Botox out. With filler, you can physically take the Botox out, or you can dissolve it.
Yeah, so in that immediate period, you can physically take it out. So you can see the squeezing videos, okay, in the lips and stuff. But then once it's gone through a different process, it's more difficult to do that. And actually, you may need to use a product called hyaluronidase, which is a prescription-only medicine in the UK, which has an off-label use to melt hyaluronic acid filler. The way it does it, it breaks the bonds that we just talked about. Okay, so summary.
Summary. Botox is a toxin injected into the skin at the muscle level to paralyze that muscle. It is undetectable, and whilst it doesn't break down, it wears off almost consistently after 4 or 5 months. Filler is a gel. It's a polysaccharide sugar gel, varying consistencies and thicknesses and strengths, and it is reversible and it will break down in time.
Yeah, so I think that, let's just say one thing, these are what I call medical treatments. So you can never say that everything is completely safe. But if it's injected by someone who knows what they're doing, understands the science and understands the anatomy, you can have, these treatments for essentially the rest of your life without any serious complications. Botulinum toxin, especially if you look at some of its early uses, which we're going to do a history of Botox video, its early uses are in medicine. So for things like blepharospasm, and it's been used in other areas in medicine, for example in urology in the bladder, also for spasticity with individuals with Down syndrome. and also for sweating as well. So it's got a long history of safety within the whole of medicine, really. Dermal fillers also, you know, in HIV atrophy clinics at a hospital, in our hospital medicine days, we used to use filler, and you know, it's available in the National Health Service in the UK for these individuals that essentially volume deplete as well.
Yeah, absolutely. So cosmetic use predominantly is what people think of when they think of botulism and toxin, and they think of fillers, but there's this huge medical use for them. There's numerous uses for them historically and current.
We use it in scarring. We use fillers in scarring to help rejuvenate the scar, because like we said, about 20% does convert to your own collagen. So you can get some permanent scar, you know, kind of results actually using it. So, you know, as long as it's done correctly, it's very safe. We're not advocating the use of Botox and fillers, like we've got more than enough patients. We just want to demystify things for you guys, and if you have any questions or any concerns or any previous kind of bad experiences with Botox and fillers, just let us know in the comments below, and maybe we can discuss why that happened.
I see.
So if you like that video, click like. Always hit that bell button, that subscribe button, because we're always uploading new videos. Like at this point, we've got over 60 videos that we've recorded.
To come.
So don't worry, if you're enjoying the content, there's more to come. If you want us to talk about anything else, also let us know as well. Thank you so much.
Thank you.